Welcome. My name is Peter Strong. I'm a professional therapist based in Colorado, and I offer Skype therapy. So this is online therapy delivered via Skype. So Skype therapy is basically any form of psychotherapy that's delivered over Skype. The thing that is so important about the use of Skype is that it allows you to see each other, and that's really essential for effective online therapy. So if you are interested in this incredibly powerful alternative to in-person therapy sessions, then you should consider Skype therapy. I certainly invite you to contact me if you have any questions about Skype therapy, and if you would like to explore whether this is a good approach for you and your specific needs. Simply go to my website and send me an email through the contact page. So the advantage of Skype therapy is that it's very convenient. It's very much more comfortable for most people. Everyone that I've worked with really enjoys the online format. It's much less intimidating than talking to a therapist in person, and this is quite important. It makes psychotherapy much more available for you to consider. There's less of a barrier to entry. It's much less clinical in nature. That's not the intention of Skype therapy. It's not a medical treatment. It doesn't really advocate medical treatments for working with psychological conditions like anxiety and depression. Most people that I work with are simply learning for more effective ways of working with their emotions. They want to learn how to work with their anxiety and depression so that they can overcome these habitual emotional reactions and return to a state of greater well-being and freedom. And that's the goal of Skype therapy as I teach it. I specialize in mindfulness therapy, which is basically how to apply mindfulness to work with your emotions and to promote healing of anxiety and depression and any other form of emotional suffering. So if you want to overcome anxiety and depression, you need to approach it as a psychological problem, not a medical problem. Medications may relieve symptoms for a while, but they do not do anything to change the underlying psychological process that produces your suffering. So we need to examine that psychological process, and mindfulness is simply a very powerful form of conscious awareness training that allows you to really investigate what is happening in your mind, what is causing the anxiety and depression. And there are two basic processes going on that feed anxiety and depression, and those are habitual reactive thinking and emotional imagery. So habitual reactive thinking is the process whereby the emotion triggers the proliferation of thoughts. These could be thoughts about what if something happens, the what if thoughts we call them. It could be rumination over something that's happened. It could be chronic worrying. It could be all kinds of negative thought patterns that have the same effect, which is to feed the underlying anxiety. So the principal first step in freeing yourself from anxiety or depression is learning to break this habit of unconscious, habitual, reactive thinking. We have to learn to break free from those thoughts that feed the underlying anxiety or depression. The way that we go about doing this is by meditating on those emotions. We use meditation to focus mindfulness on the emotions so that we can see these reactive thoughts more clearly, so that they stop operating subconsciously as a habit. You can see them very clearly, and when you can see your thoughts more clearly, you begin to break free from that subconscious influence, because you now become the observer of those thoughts. And that observer is essentially separate from the thoughts. The observer is not the thoughts. So the more you see of your reactions, the freer you become. So that's the sort of fundamental mechanism of mindfulness training, and you have to meditate on your emotions if you want to break free from your anxiety or depression. You cannot avoid them and try to escape them. You have to investigate the habitual patterns that are operating at the psychological level that are feeding those emotions. Typically, at the core of anxiety and certainly depression, you will also find very core emotions, often based on emotional trauma that has not been resolved or healed. So that internal trauma, that distress, that deep need, neediness, or it could be a tremendous hurt or pain, or sadness or grief, or feeling of loss. These are all examples of core emotions that feed anxiety and depression also. So when we are learning to meditate on our anxiety and depression, we're also looking to see these emotions underneath the anxiety or depression. And we establish a mindful relationship with those emotions. And this is essential for helping them heal. You have to build a conscious and non-reactive relationship with your emotions. This allows healing to happen. Emotional suffering will always try to heal itself if it's free to change. The problem is that reactivity, which takes away that freedom to change. It feeds the emotion in much the same way as fuel feeds a fire. If you take the fuel away, the fire is now free to do what it wanted to do in the first place, which is to extinguish itself, to burn itself out. So this is a very important principle. Overcoming reactivity promotes healing in a very big way. So the more that you can establish mindfulness internally with all of these individual emotions that are making up your anxiety or depression, the more healing happens and the faster it happens. The second way we work with our emotions is to look at their imagery, because that is what actually organizes the emotion. So if it's depression, it will have a certain color, it will probably be very large in size. It will feel overpowering, implying that it's large and also at a high position in your psychological field of vision. It will have lots of different characteristics to it that are what actually gives structure to the emotion and causes it to be depression or anxiety or anger. You can think of the color of anger. Most people notice that the color is bright and usually red or orange. That is part of the structure of the anger. With depression, it may be dark colors, black or purple. That is part of the structure of depression. These components of that imagery are what actually creates that emotion. And again, the imagery is simply habitual in nature. But when we start to become mindful of that emotional imagery, we can begin to change the imagery. And when the imagery changes, then it heals. So this is a very direct and very effective way of working with the structure of your emotions. So these two components, working with the reactive thoughts that feed emotions and the imagery that structures the emotion, are a core part of mindfulness therapy. And I can teach you all of these things over Skype. I will teach you how to apply mindfulness to heal your anxiety or depression, to overcome those habitual emotional reactions. It's very effective, and most people see dramatic changes within a few sessions. Usually, this direct approach to working with the process itself that causes anxiety and depression is much more effective than simply talking about your emotions, as is common in most forms of counseling. So if you'd like to learn more about the mindfulness approach to working with anxiety and depression, and you like the idea of doing Skype therapy, then do please contact me and let's schedule a Skype therapy session. Thank you.